Hey there, this is Sam Chan, physical therapist at Bespoke Treatments, New York. We're going to go over knee extension mobilization today. So we'll be sitting on the floor. Make sure to grab a belt or a strap to help you with this drill. What we're trying to work on here is to really straighten the knee out, push that knee down to the floor as much as possible, increase that extension in the joint. So what I'm going to do is place the strap right around your toes. And there's going to be a couple of steps to this. First thing I want to do, you can use your hands to help you out, push straight down into the floor. And you're going to start to feel a small stretch at the back of your knee. Now, as you push with your one hand, take the opposite hand, take my left hand, and start pulling with the strap, pulling the toes towards yourself, toes towards your nose. Now, finally, third step, I'm going to add in the lean. As I lean forward, you're going to start to add in the hamstring stretch. So right now I'm getting a stretch in the hamstrings, stretch in the calf, and also a nice little stretch right behind the knee itself. Really kind of lean into this, push down, get that knee as straight as possible. We're going to hold this for 5 to 10 seconds, then relax. You can try this exercise for 3 to 5 reps per set. Again, let's try that. Lean forward, pull with your hand, add a little extra overpressure on the top of the knee. Really trying to get the knee down to the floor as much as possible. It's really important post-surgery to get your normal range of motion back as soon as possible. So make sure to do this drill multiple times a day.